So that was kind of a quick rundown of surgical services. Now let's talk a little bit about non-surgical. This is all the stuff that's in the video. The surgery stuff doesn't have as much glamour to it. All this non-surgery stuff does. And really, that's where the confusions it lies out there for the public. So let's start first about fillers. What are fillers? Fillers are natural substances that come in a syringe, and you can place them underneath the skin in any line or wrinkle that you do not like. These are, collagen was one of the early ones. Now they've come up with longer lasting fillers, but they're all natural fillers for the most part. So these are made from components found in cartilage, components found in bone, and those are, and I do, I'm actually one of the busiest surgeons in all of Northern California doing fillers. So I have a tremendous amount of experience with that, and some fillers are for different parts of the face and so on. A common place for people to consider getting a filler is in these nasolabial fold lesions here, right in there. It's one of the early signs of aging, and that takes 15 minutes. There's another filler called Radius that can last up to a year. I really love doing that, and I do a lot of fillers. So that's one area that you can apply fillers to. Another is if your lips are got some lip lines around here, or if your lip is thinning and find that it is a little shrinking with age. The upper lip tends to thin as we get older. Adding a little bit of volume to that really looks great. I'm not really talking about the jumbo Angelina Jolie lips, okay? People say, no, I don't want those lips. I'm like, all right, we can do any kind of lip you want. Most people just want a natural looking lip, something that they may have had a few years earlier. The back of hands are a very popular area also. You can do everything to your face, but when you reach out with your hands, they really can show your age. And it's the veins and the tendons that can really be noticeable here, and the texture and the wrinkly skin and things like that. Put a little filler in there. It stretches it out. It gets rid of those blue veins and the tendons and the aging, and it looks great. People love it when hand rejuvenation is done. And the skin is so smooth when you just add some volume to it. It's really nice. Another popular area, I gave a secret. Our eyes. Here's an example of a lady that had one eye with and one eye without. So she's mid-50s, very typical to get this little bulging of fat there and then a little bit of an indentation there. And we just fill that indentation with Restylane. That is immediate. I took that picture 5 seconds after I was finished. So that went for 15 minutes to go from there to there. And I liked it so much that I did it on myself. So that's me. That's what my natural eye looks like without any filler. Look at that. Boy, it's a good looking guy with that. So those are my eyes, and I still have it that way right now just so I can show patients one eye with and one eye without. It's a very popular thing. It takes 15 minutes, and that can last up to a year. So our next slide, not that I like seeing myself up there too much. Okay, Botox. Botox has been around for 18 years or so. Botox is a medicine that we put in the muscle to relax the muscle. Well, why is that important? Well, there are certain muscles that when we use them, it causes lines to form on our skin. When you scowl at somebody, it leaves that 11. When you raise your eyebrows, it leaves those marks in the forehead. When you squint and smile a lot, it leaves these things called crow's feet. So Botox is a medicine that works absolutely wonderfully well. Takes 5 minutes to do and lasts about 3 or 4 months. And there's nothing that can work like what Botox does. It is a great invention. And here are some examples just between the two eyebrows of this lady here, from there to there. She doesn't have that mean scowl look. really just makes the whole upper face near the eyes look fabulous. So another non-surgical option that I wanted to discuss is something called thermage. Thermage is a machine that I use that has probably been out for about 8 years. It was really the first one in skin tightening. So it's a machine, you apply it to the skin contracts. It's good for different parts of the face and the body. It works nice. It's not a facelift, but it's 25% of a facelift. So it's pretty easy to do, it takes about an hour. Here's an example of a lady that just had her neck and lower face done. So this is before and that's after. Not as dramatic as the surgery pictures that I showed, but also she can go back to work. That day, she just pops in the office for 2 hours, gets this done, and this will continue to improve over a period of several months. It's a great option for people who are looking for non-surgical choices to help rejuvenate their skin. I'm trying on the slide to go over here. Okay. Another area that works really nicely is around the eyes. So this lady had some pudding here, and a thermage treatment was done around the upper eyelid, and it raised the eyelid crease. A lot of that heaviness that she had around the eyes is improved. It takes about an hour, hour and a half to do. It's a non-surgical option. I think it would be a great thing for someone who's not quite ready for eyelid surgery, but has a little extra skin around their eyes, and they don't like it. So, easy to do. Takes a little over an hour. And this will last you a couple of years. I see this often in after delivery, that the skin didn't quite shrink down 100%. And you get a little bit of, laxity around the abdomen and the belly button. And there we go. So she had this tightening procedure done, and now her six-pack abs came back, and she looks a lot better. Very pleased with that. That can actually last 2 to 3 years. And the only other option years ago was surgery. Okay, and this is not surgery. Okay, so at my